All right, so hi, I am here with Maria Gmitro, and my name is Alice Emerson at the Holistic Chamber of Commerce here in Mount Pleasant. So, Maria, I love that you're part of the Holistic Chamber of Commerce, and I love your advocacy work that you're doing. And you have been, a founding member of our chamber right from the beginning. Your work was so intriguing that you've done with the Breast Implant Safety Alliance, but you've expanded into some other areas, and I'd love for you to bring some awareness about these medical devices, not just the implants, of breast implants, and that's been all over Facebook and getting more attention, but you really want to use this time right now to bring it to about all medical devices, right?
Yeah,
Yeah.
I'll just do a little around how I got started in all of this. In 2014, I had done some research and selected to have new FDA-approved breast implants placed into my body. And eventually they started making me really ill. I didn't realize at the time that the implants were the problem, because you don't normally go back to your plastic surgeon. You start seeing all these other doctors. And they started making me very ill. And I found out through social media that the implants could possibly be a problem. I had them removed. I started regaining my health. And I learned that there was a problem with breast implants causing a lot of issues for people, as well as other medical devices. So I founded Breast Implant Safety Alliance, and I met Alice working on the Holistic Chamber, because basically when you're dealing with these illnesses, you end up, for me, I had a lot more assistance in the holistic community helping with symptoms and issues. So I founded the Breast Implant Safety Alliance, and we work to advocate for safer medical devices and bringing awareness to these issues. And while I was working as an advocate for medical device safety, I came across a company that is helping change the standard of care. So the problem with medical devices, not just breast implants, is that we don't actually have accurate data. What we know is that less than 10% of adverse events are even reported to the FDA. The only people that can report problems with medical devices that's mandated to do so are the manufacturers. Patients do not need to, they're not required to, and surgeons are not required to report this as well. So how can we, as a society, or medical professionals, how can you make informed choices about your health when you don't have accurate information? And one of the biggest problems we found with the breast implant issues is that there was a recall with breast implants. And daily we're coming in contact with women that were not aware that there was a recall. And this particular breast implant, these textured implants, were contributing to a particular type of cancer, BIALCL. So there's a real problem here because, number one, we don't have the accurate data. Number two, patients aren't being alerted of recall devices. And not everybody is even aware that you can report problems with the actual devices.
Right now, the only way to report, and we're talking hips, we're talking shoulders, we're talking all sorts of different medical devices that are implanted, staples, which you'll get into examples of some of these in a minute, I'm sure. But right now, it's only through the FDA. Like they have a specific website that you can do that. But
right now, it's called the FDA's MedWatch program, and anybody can file a report into MedWatch, whether you're a doctor, a patient, or a manufacturer. The manufacturers are the only people that are required to do so. Doctors and patients are not. I didn't even know that that was something I could do until I started getting involved in this advocacy work. And of course I did. I filed a report with MedWatch when I was having issues with the medical device. And then once I removed the medical device and had, positive changes in my health, I went back and updated that report. The TrackMy Solutions company is working on a solution to make reporting adverse events to the FDA much easier. And we are also in our advocacy work requiring or working on a bill so that doctors are mandated to report adverse events to the FDA, because right now they are not mandated to do so.
That's amazing to me that they're not mandated to do that. So if I had a problem with my knee replacement, for instance, which I don't have, but let's say I did, and I went to him and I said, I'm having issues with this. And I'm looking at all the marketing material to, get the knee replacement, and it's all very favorable because it comes from manufacturer, right? So if I wanted to do further research to see if there's a problem with anybody else having, an issue with this particular knee, like you said, the information isn't reported, so therefore it's not accurate. So patients are not being able to make informed decisions. So I love the work that you're doing so that patients, all of us, can make informed decisions based on real information, just not the
Right.
marketing material, right?
Yes. And if you do have a medical device in your body, and at this point, we all know somebody that has one or several devices in their body. One of the biggest problems we're running into, and we saw it with the breast implants, we see it with all these other devices as well. You're lucky if you as a patient are given any information about the actual device that's in your body. A lot of times, you might get a piece of paper with the information on. Sometimes it's a little laminated card. Some people even do have a plastic card, which is great. You definitely need that information. The problem is that people lose that information, right? It's a piece of paper. Things might get lost in a move. And then you want to go back to your doctor and find this information out, but your doctor doesn't need to keep those medical records for very long. So we know that the average is about 7 to 10 years that doctors are holding onto those records. After that, they can be destroyed. So a lot of time people are keeping these devices in their body well beyond the 7 to 10 years that a doctor might be holding on to this information. And TrackMy Solutions, their solution is to create an electronic ID card. So you take that information and you create an account. They'll help you find your exact device. In the event of a recall, they will alert you, because right now there is no alert system in place. You're lucky if a doctor will send you that recall information. You're lucky if a manufacturer will. What we're finding, especially with breast implants, people are not alerted of these recalls. Some are, but when we did our poll, about 80% were not. The way they were finding out about recalls was through social media, or maybe on a news program, or most of the time, patients are finding out when they see an ad for an attorney on TV about issues with a particular device. So we need a system that alerts patients in real time. We need a system that will follow you forever, that is going to track that information, hold on to that information. It's also really important for doctors, because doctors, if you want to alert your patients all at once, you would be able to do that in an instant, because you would have that database. And maybe you need to inform all of your patients right away, so that if there's something that needs to be done about these recalls, you can contact figure out which patients have these devices and alert them so that they can come back in for some care.
It's, on another note, I remember in a conversation that we had, besides for just the recall information, or, that's very important, but also important for tracking is, let's say you had to go for an MRI or something like that. Talk about that a little bit, like how it can actually be used during your medical care and treatment, like, just to be able to.
We had a conversation with one of the surgeons that uses the TrackMy service, and he had said that, let's say, your mother is visiting you from out of state. She falls, she gets hurt, she goes to the hospital. They need to figure out, can she go through the MRI machine? They don't know. She's got some devices. They don't know what they are. They don't know what it's made out of. This is not information you normally keep on you. So if they were able to just log into this database, whether it's the patient or the doctor, they can see exactly what it is. Right now, let's say mom is in the hospital. She's there several days getting care, and we're just waiting on medical records. So that takes several days where, this could be done in an instant, and you can figure out, can she go through the MRI machine or not?
That's amazing. So many great uses for what you're doing and the advocacy work that's behind it as well. And I put in the chat there all the different links that you have, but why don't you mention, the different advocacy groups that you're working with? I mean, you have a real heart for this. I mean, I'm really proud to know what you've been doing here locally, but you're making a global impact as well. But go ahead and share your advocacy links and information.
Last year, I spoke at the FDA hearing on the safety of breast implants. And ever since then, just seeing how many people that this actually can harm, and that there's a lack of information. We founded the Breast Implant Safety Alliance. We also work with some other advocacy groups, the medical device problems advocates, and a lot of those advocates were in the documentary The Bleeding Edge. This is a perfect time to watch a documentary, and very
that's on Netflix, right? Bleeding Edge, yeah, I've seen it.
Mm-hmm. And it discusses a lot of different devices and the problems that they're seeing with the devices. There's a group, Medical Device Safety Congressional Advocates. We are working on 2 bills right now, the first one being Medical Device Safety Act. And this bill, basically, if you've got a class 3 medical device in your body and it causes harm or death, you're not protected. The manufacturers are protected. So the only people that can sue are the investors. And that doesn't help when you've been harmed by a medical device. And some of these people's lives have been completely devastated. And so we want to make sure that patients are protected, because right now with the manufacturers protected, how do we know that they're going to give us a safe device if there's nobody holding them accountable? So we need them to be held accountable so that we're making sure we're getting safe devices. The second bill that we're working on is the Medical Device Guardians Act. Because I said earlier that the manufacturers are the only ones mandated to submit adverse events. And we need doctors to be mandated to submit adverse events so that we can have true data on problems with particular devices. So those are the 2 bills we're working on. If you have any interest in advocacy work and learning more about that, I put that group in there. Of course, registering for a TrackMy account is free for patients. So even if your doctor doesn't subscribe into the service, or your hospital, it doesn't matter. You as a patient, TrackMy, it's one of their ways of giving back and helping you be your own advocate is, for free, you can create an account. They will help you figure out what information you need to put in so that you can track the particular devices that you have in your body. And that's TrackMySolutions.us. If you want to learn more about our Breast Implant Safety Alliance, or you have questions about issues with breast implants, you can reach me, Maria Gmitro, on Facebook. You can go to our website, breastimplantSafetyAlliance.org. We are trying to work on some state bills so that everyone receives informed consent, and that you're familiar with the possibilities of the cancer that can happen, or the breast implant illness issues that can happen. We work with a lot of other advocates, medical device safety advocates, for several devices, not just breast implants. We also work with those that have been harmed by, say, the Assure device, hips, shoulders, knees, pacemakers, you name it. And I want to mention that the reason that this particular company started, our founder, Jeremy, his best friend's grandfather had a pacemaker, and I guess the battery was having issues. They didn't realize that there had been a recall. they had no idea. And if they had known, then they could have taken different steps for treatment. But unfortunately for him, it was too late. So that is kind of where the company started. And they're
Wow.
provide better patient care so they can, save lives.
Save lives, absolutely. That's amazing. I mean, you've mentioned, knees, hips, shoulders, pacemaker. There are other, mesh and other female things. I mean, does it cover, some people use like the birth control things that are inserted, but how about the story with the young man that had the staples? I mean, people get staples quite often after surgeries, right?
Mhm.
And so just mention that, because I just don't think that I love bringing awareness to this, because, everybody has been paying a bit more attention to the breast implants, right? But we're talking a wide range, including staples. So yeah, what happened there?
Yeah, if on our TrackMy Solutions Facebook page, we've been sharing different patient stories about, just people that have devices in general, or and some might be TrackMy Solutions users, account users. This particular advocate, her son had some type of surgical staples. I forget what the reason was, exactly why, but they found out that he was having some type of reaction to them, and these staples were recalled. And she had no idea that they were recalled.
Wow. Wow. And so, yeah, like you said, you're saving lives by bringing awareness to this. I mean, it's not just, you know, I mean, truly, like the pacemaker, the battery, the implant. So thank you so much for everything that you do and sharing this and bringing awareness and education, and doing the advocacy work and encouraging us to make informed decisions, um, but also taking action to be our own advocate for not only ourselves, but somebody we know and love has, I mean, had an implant of some sort. I mean, I'm going to make sure I reach out to my brother. I know he's had 2 knee replacements, to make sure he has that information on file, and I'll share this link with him as well. So thank you so much, Maria. I appreciate you. And is there anything else you want to wrap up? You've done a
No,
great job sharing everything. So,
thank you. And I appreciate being a part of the Holistic Chamber, because as we've talked in the past, you start having these health issues and you can't quite figure out what the root cause is. It's a lot of the holistic care that really helps a lot of patients.
yeah, the holistic, thank you. And I do, I love our holistic providers and this community, in that they really do get to the root cause, instead of just working with the symptoms, because a lot of times you get a lot of crazy symptoms when you have these implants and your body's not really receiving them that well. So thank you so much. And I appreciate you being live with us here and being, in the chamber, and we'll continue to support you in your work as well. So thank you. I appreciate you being here.
All right. Thank you.
Thank you.